On the COVID front tonight, the numbers are still trending down. It's welcome news all around, especially for doctors and nurses who had such a grueling summer. We have a total of 133 COVID patients in Jefferson County hospitals tonight. While the ICUs are all still full, only half of the patients there have COVID. And this bar graph really puts the decline into perspective. We're dipping down to some of the totals that we were seeing at the beginning of the year. But there is a secondary condition that is connected to COVID that's creating concern for doctors and parents, something that's called MIS-C. That's a rare inflammatory syndrome mostly seen in children after they catch COVID. Doctors are still researching MIS-C. They don't know why the illness affects some children and not others. According to the CDC, children and adults can contract MIS-C 4 to 6 weeks after a COVID infection. Different body parts, including the brain and the heart, can become inflamed. Symptoms include everything from fever and diarrhea to skin rash or vomiting. 12 News reporter Amelia White spoke with one Port Neches mom and a doctor tonight. They both are telling parents to be vigilant.
I've never seen this happen. Whenever we brought him into this emergency room, he was almost non-existent.
12-year-old Jaden Sorensen was super sick. And initially, doctors didn't know what it was.
He was like, we have a better chance of being struck by lightning than having this condition because it's extremely rare.
Rhonda Sorensen's son was admitted to Texas Children's, and that's when she found it was MIS-C.
Well, little did he know that I've been struck by lightning.
Rhonda says it all started with a positive test result.
Okay, he had COVID. He was diagnosed August 19th.
We asked Beaumont pediatrician Ramona Ataya-Decor about the condition. She's not treating Jaden.
MIS-C is multi-system inflammatory syndrome in children. It is typically occurs 2 to 6 weeks post COVID-19 infection.
Dr. Decor says MIS-C symptoms are impossible to miss.
They'll have abdominal pain, nausea, vomiting. There's other issues, maybe cough, maybe respiratory stuff. They could have rash, swelling of the hands and feet, swollen lymph nodes, conjunctivitis, which is your eyes become very pink and red, cardiac issues, respiratory issues.
With the kids back in the classrooms and a Delta variant lingering, Decor says the threat for MIS-C remains.
This is actually occurring mostly in children that have not been eligible for vaccination yet.
Dr. Decor wants parents to hear this.
We do not believe this has anything to do with vaccines.
But if your child gets seriously sick, act quickly.
The sooner they get help, the better they do.
Something Rhonda is glad she did. Now she just wants to bring awareness to other moms and dads.
I want to put the message out there to every parent, go with your gut instinct.
In Beaumont, Amelia White, 12 News.